We've had to prepare in many ways for other type of, endemic threats. Everyone remembers Ebola probably and how we did prepare for that. The flu is still a major killer of people across the world. But we have treatments, we have vaccines for the flu. It's a little bit different with this, and because it's the most recent pandemic, and we've gotten seen experience across the world about what it can do, we need to be prepared. There was a point, I guess, in belief that this is going to be a seasonal virus. It's going to be very localized. It's not going to be transmitted. It's not going to become an endemic, and that it's not going to be a problem. But clearly, probably 3-4 months ago, it wasn't viewed initially as getting to this problem, getting to this degree of problem. But now it is, and it's clearly seen that it's spreading, and it's spreading wildly, and it will be an endemic, and we do expect to see it worldwide. I think that it's a virus that's easily transmitted by viral droplets. We've seen other countries who have suffered without perhaps the best preparations, and that's why I think it's important for us to take steps to prepare and get ready for this and do everything we can. First and foremost, to protect the parts of the population that's most at risk. The patients who have comorbid conditions, people who are sick, people who are in the hospital need to be protected. I think second large population that needs to be protected are our healthcare workers, our EMS providers, our public safety officers, who we depend so much on for the care of the ill, but also for public safety and response to bring ill patients to our hospitals. So everything that we can do to protect those people and minimize the spread of this disease through our communities is in order at this point. We're associated with the University of Maryland Medical System. We have experts in the field in providing evidence-based practice, evidence-based best care to care for these patients. We've also stood up our own internal incident command centers to mobilize all the various elements and assets within our healthcare system to get prepared. So we, with the University of Maryland Medical System, meet 3 times a week now to discuss issues of everything from how to care for these patients, how we're going to care for these patients, but also preparing for what we expect is a potential huge number of patients. The surge that you mentioned is a very, very real possibility. And how do we manage a situation where we need 50% more ICU beds that we currently have, or 40 to 60% more inpatient beds that we have? And we are mobilizing plans. We're getting ready should we need to execute and have additional not only beds, but care providers as best as possible, and management of these patients who can be very, very sick. And for those of you who might not know what the Incident Command Center is, or Incident Command System is, it's a series of processes that identifies things that need to be done in a oftentimes organized but hurried fashion to prepare ourselves so that everyone knows where the personal protective equipment is and where it's stored and how to access it. If we need 17 ventilators, where do we find them? How do we move them to where they're needed? If we need 15 or 20 more intensive care beds, you can't just build them overnight. How are we going to manage to provide intensive care for our patients when perhaps our ability in our current intensive care beds are exceeded? And we have plans to do that and processes in place that we're ready to do that when the time comes. But Shore Regional Health is devoted and committed to care for the 5 counties of the Eastern Shore. That's 170,000 people. That's still a lot of people that need to have their health care needs met. And we are mobilizing our plans and our resources to be best prepared as possible to address those needs when they arise. We are going to limit travel. One of the first things we try to do is to not have the disease spread throughout the population. So Again, limiting travel, not having necessarily allowing people to come into the country, or having our staff members travel out of the country are key factors in trying not to have the spread of the disease. The other thing is, of course, personal things that we can do to help minimize the spread of the disease. First and foremost, if you're ill, please stay home. Isolate yourself, stay home as best as possible, keep yourself healthy. Obviously, that goes without saying, because if you're sick with something else and you happen to get the virus, that only increases your chance of having perhaps a poor outcome. Well, we know some about this virus. First and foremost, about 80% of people who get the virus have a very mild disease, flu-like symptoms, perhaps a fever, a bit of a cough, and most recover from it very well. It's that 20% of the population, as I mentioned before, who have other medical conditions or are not well that we need to be careful about. So again, if you need medical care, if your symptoms are such that you're having a great difficulty breathing or having other issues that you would normally seek out your healthcare provider, and you're having symptoms of flu-like illness, fevers, either the first thing to do is, of course, to call your primary care provider and ask for direction. I would not recommend that you come to the emergency department with the symptoms of flu-like illness alone and of itself. We do not have the ability at this time to test for COVID-19. And again, we recommend that the best thing, if you're having a flu-like illness, is to stay home and isolate yourself. So if you have the disease, you won't spread it. But again, if you have other symptoms that indicate you're significantly short of breath or having other complaints, you would access health care as appropriate. So today, right now, our ability to get COVID-19 testing depends on collaboration with the state, with the local health departments in the state. We are able to obtain samples, but those samples need to be sent out to a state laboratory. The departments of health has to approve the testing, though, because the number of tests that are available are limited. So showing up in a doctor's office or an emergency department requesting a COVID-19 test will not necessarily result in it. And that's why it's not a good thing to just show up requesting testing. At this point, we are only testing when you meet certain criteria, which include travel to the areas where the virus is endemic, or exposure to someone who has known COVID-19 or been exposed to COVID-19 patients. That's a difficult thing, and those criteria have to be met before the state, at this point, authorizes the testing. I do believe in the near future we will have testing available and sort of on demand, but at this point, there are just not enough tests. And again, the state lab is the one that's currently conducting the test for us at this point, and there's a backlog. The turnaround time now is somewhere between 24 to 48 hours before we can get the results back once they've received it. Again, the University of Maryland has set up its incident command. Shore Regional Health has set up its incident command. We meet Monday through Friday daily to talk about the current status, how many patients have been actually tested, how many have been tested negative of those that have been tested, how many cases we're waiting for the results to come back on. We get a report daily about the number of patients actually worldwide are positive, how many patients are positive with the disease in the state of Maryland, how many patients are hospitalized with the disease in the state of Maryland. So that's on a daily basis, updated every single day. And if we're successful, we're hoping that we won't have the surge. If we can minimize the spread of the disease within our communities and minimize the spread that way, we're hoping the surge doesn't happen. But we're keeping as I said, we're keeping very, very close tabs just on the number of people that are tested in our system and on the Eastern Shore. Then we report we haven't had a positive patient yet. I hope we never do have a positive patient, but once that occurs, it's reported, as I said, on a daily basis. And we'll know where in the system they are, and of course they'll be investigated to see who else might have come in contact with that patient and what other steps need to be taken from a public health perspective. In very, very close collaboration with our county health departments and the University of Maryland Medical System. There's some wisdom in not going into large gatherings, or even gatherings where you can't stay 6 feet away from someone, because you don't know where they've been. You don't know who they've been exposed to. And the reality is we should, each of us, take our own steps to try to minimize the transmission of this virus within our own communities, and again, protecting the patients who are at risk, our healthcare workers, our EMS workers, and our public safety officers. There's one silver lining in this virus. It doesn't seem to particularly attack the young. The thought is that because coronavirus is a common virus, COVID-19 is not, but other coronaviruses cause the common cold, and children have that acquired immunity. So children don't seem to be particularly adversely affected, at least at this point. They, of course, do provide a great vector to be able to transfer it to others. So we still have to use the same principles in trying to prevent the spread of the virus from those populations, even if they're not sick. And I'm hoping in maybe 2 or 3 months, someone will say, oh, geez, you guys did all this planning and we didn't have to do it because we never had a surge. It's a good exercise to get ready, and I hope that we're doing all this and we never get a surge, because it could be very devastating to our communities. And remember, the surge of all these patients with COVID-19 will adversely affect our ability to care for our patients, because they'll put such pressures on our healthcare system. We have to work collaboratively together. If we're blessed on the Eastern Shore not to have any patients, and we do have supplies that are needed elsewhere, and the pandemic has spread, you've heard on, let's suburb of Seattle or a suburb of New York City, and they have a pandemic spread there, we have an obligation to help our fellow communities as best we can. So we need to work collaboratively together as a state with each other, as well as a nation, to make sure that as best we can, we stay prepared should it come to us, but we also collaborate and use our resources wisely to help those who might be in need. I'm hoping that we can try to keep the hysteria at a minimum, trying to keep people informed, trying to have our populations understand that we're prepared. We're going to do everything that we can to be prepared for the surge if it comes. I suppose we could all say a prayer. We hope that the COVID-19 virus is a seasonal virus, and as soon as the nice warm weather here on the Eastern Shore comes, we'll see a decrease in the occurrence of the virus, like we see with flu season. We don't have any evidence to suggest that that's going to happen, but we can always hope for that.